Hello and greetings. I just want to piggyback off of my last video. I talked about my infusion and I mentioned about my ENT. Yes, I want to talk about that. So I went to the ENT, about 2 months ago. I have been having a post-nasal drip for over a year and a half. And no, my nose isn't bleeding. Yes, I can breathe out of it. But yes, I do have a post-nasal drip. And I have been given 4 different nose drops. Neither one of them works, except for maybe the Bromax. It partially works. So I do use it, but nothing else works. So I went to the ENT, and by the way, make sure you bring someone with you to some of your doctor's appointments. And I brought my aunt with me, whom I also mentioned in my last video, who cared for me when I was at my lowest point back in 2018. She went with me because I needed a second ear. Because when I went to my first appointment, I went to the ENT. I had all of my appointments done. I had a CT scan done on my sinuses. And then while me and my mom was on vacation early June, I wind up having a debacle with my sarcoid. I wind up getting big bruises all on my arm. I had to call my dermy to let them know what was going on with me. I sent pictures of the big bruises on my arms, and not only that, I got a call from the ENT stating I need to see a surgeon. And also I had my allergy shots done. Not allergy shots, but allergy testing done at that time, and found out I was allergic to something weird. Anyway, so after speaking with the ENT, I was told that I needed to get off of one of my meds in order for me to have a different set of allergy tests done. So they did the blood work allergy test, which they all came back I wasn't allergic to anything. But the problem is when you're on a immunosuppressant drug, the blood work doesn't let you know that you are allergic to anything. It comes back normal, and that's because your immune system is suppressed. And the kind of drug that I am on, which is mycophenolate, suppresses the immune system. It comes back really inconclusive. So they need to do a skin test. And in order to do the skin test for the ENT, I have to be off of the mycophenolate. Well, I can't be off of the mycophenolate because then my body will be in a chaotic situation. So I can't have the skin test. Well, needless to say, during that time, me and my mom was on vacation. I got the call from the ENT, and they said I had a sinus disease and I needed to see the general surgeon. Well, I asked them what kind of sinus disease did I have, and the problem is they could not tell me what the sinus disease is. I was on the highway coming back home because I had broke out in a massive flare on my skin that I needed to be back home because I needed to get medication that the doctor had prescribed for me from my dermatologist. And let me just tell you, it was a ball of a mess, a big giant mess. So while driving home on the highway, I wind up talking to my dermatologist and wind up talking to the ENT. I already had an appointment scheduled with the ENT, and so we had to reschedule the ENT appointment to a surgeon. So we scheduled that surgeon appointment, and I didn't see the ENT. So when I got back in a couple of weeks, I wind up seeing a ENT. I took my aunt with me. Yeah, I'm so glad I did. So we get to the ENT appointment, and they finally call my name. We go in there and we're talking. And so I got two issues. My nostrils is always stuffed on one side or the other, literally. And it's been like that for a year and a half. But I can breathe, still breathe out of them. And then sometimes they open up. But the problem is I have a post-nasal drip that's driving me nuts. And then I know I have a sinus issue that bothers me a lot too. He said he could probably fix my problem, but it wouldn't be 100%. So he said he wanted to cauterize the tendrils in my nose. I'm like, huh? Yeah, cauterize. But it wouldn't be 100%, but it would really help with the postnasal drip. Or he could do, I can't remember what the other thing is. But anyway, he kept going on and on and on and on and on about it. And I'm like, no, sir. I'm thinking in my head. And so my aunt was just strategically sitting there and just listening. I needed the second set of eyeballs. So when the appointment was done and over with, I couldn't wait to get out of there. And I'm asking my aunt, so what do you think? And she thought the same thing I thought. He just wanted the money. He kept pushing me and pushing me and pushing me and wanted the money. And I told her right then and there when we got out of there, I'm not going to have the surgery because he already said it wasn't going to be 100%. And because I wanted to know about the sarcoid and if he knew anything about sarcoidosis. Oh yeah. I've had sarcoidosis patients before. It did not even sound like he knew anything about sarcoidosis. He sounded like a complete jerk. Absolutely complete jerk. And me and my aunt, she said the same thing I thought. We're both Sagittarius, by the way, and we do think alike. And we just hooped and hollered and laughed. And I'm like, no, sir, you just wanted the money. That's why I talked to my dermatologist about it. And he agreed. So basically, I'm really in a big giant flare, and I'm not having that ENT surgery. So needless to say, like 2 weeks later after that appointment, the ENT calls and wants to schedule this appointment with me. And I told them, nope, no surgery for me. I'm not going to have it. I'm just going to live with blowing my nose every day. And I'm just going to live with the drug that they said they had given me, the nose drop, which was the Bromax. I'm just going to continue to just spray Bromax in my nose and let it work partially, than to go and have a surgery that's not going to work 100%, which is just like using Bromax. So why? Anyway, that's my rant on my ENT discussion. Just so I can clarify what I was talking about in my infusion video. Now you understand why my dermatologist said what he said and agree with how I felt about the ENT debacle. Well, at least that's how I feel anyway. But no, I will not have ENT surgery. And I'm happy with my decision. And like I said, people who have chronic illnesses, we need advocates. And sometimes you just have to advocate for yourself. You have to do what you need to do for yourself. Period. Stay tuned for another sarcoidosis story. See you later. Thanks for watching. Don't forget to subscribe.